Rolling.
Hello, I'm Mandi, Director of Safety Services for Associated General Contractors of Washington. And I'm here to talk to you today about opioids in construction and how you can create a culture of care in your workplace to prevent opioid overdose deaths. First of all, you're probably wondering why opioids are such an issue in our industry. So I wanted to impart that construction has one of the highest rates of opioid related deaths in the United States. And opioid related overdoses are up 30% just since the COVID 19 pandemic has hit. Unintentional overdose fatalities in the construction industry have jumped from 7 deaths in 2011 to 65 deaths in 2018, a ninefold increase in 8 years. We've been on a trend for the last 10 years of continual growth in the number of opioid overdose deaths in construction. Some of the contributing factors that you should be aware of from the construction industry are the fact that we perform physically demanding work. That physically demanding work results in pain. Sometimes that physically demanding work results in workplace injuries. And in both of those cases, employees may be prescribed opioids as a mechanism to treat that pain. So sometimes opioid addiction starts out in the most innocent of manners, and yet you end up prescribed a painkiller that's going to help you through the process of pain and getting better. And ultimately, that leads to an addiction because, frankly, opioids are a very addictive drug. Also, contributing to factors with opioid overdose and substance abuse in construction is workplace culture. Historically, construction has been seen as a industry that accepts drug use or substance abuse. Also, our workplace culture isn't necessarily the most warm and friendly environment at all times. And so, challenges because of workplace bullying, workplace stress, also just the shift work and cyclical nature of construction, having a busy season and slow seasons, all of those things are contributing factors to people having physical pain that results in prescriptions that also results in addiction, but also uh, feeling the need to numb emotional pain. If you are struggling because of stress, because of something going on in your workplace culture, because of whatever factors may be going on, it is not uncommon to have folks cope with that pain or that frustration or stress with unhealthy coping mechanisms, whether it's alcohol abuse or substance abuse, to help numb the pain or the discomfort of the things that they're experiencing. So, substance abuse in construction is an absolutely real problem that we absolutely need to address and dedicate resources to. So, to that end, what can you do? Your role in workplaces is to create a physically safe and psychologically safe workplace. Again, that physical safety, speaking up, paying attention to workplace safety and health practices is going to help prevent the injury that may be the door opening to opioid prescription and opioid misuse. Reduce stigma. This lends itself to the psychologically safe workplace that I mentioned earlier. Reduce stigma. We all have our own perceptions of what's acceptable and what's not acceptable in society, amongst our friends, for ourselves. And stigma plays a big part in that. If we feel shame because we are taking care of ourselves or practicing good, healthy behaviors, then that shame can actually be a barrier for us seeking help if we need it. Also, stigma can play a factor in decreased mental health because if someone feels psychologically unsafe, then it's going to have an impact on their mental health. And that mental health impact will play a part in the potential for drug abuse and misuse. Supervisor and worker education is really critically important. So we as people in the construction industry need to know and understand what the causes of substance abuse are, what the signs are, what symptoms may display in the workplace, so that you are more aware of if someone on your team is struggling or in a bad place. Also, it's really important that we promote alternative treatments. So, knowing that opioids are a very common prescription, some states' workers' compensation programs have actually limited the ability of medical providers to write prescriptions for opioids in treating workplace injuries because of how addictive and how chronic of a problem this has become. So, knowing what alternative treatments are available and encouraging those, and then also just sharing resources about addiction, sharing resources about mental health, sharing resources with your team about healthy coping and resilience. We've all been through an incredibly difficult, year and a half now because of the pandemic. So making sure that we're looking out for one another, making sure that we're promoting healthy coping and resilience, self care, and just taking care of ourselves as well as taking care of one another and having those resources accessible to those that need them. And then lastly, having a comprehensive substance abuse testing program can help catch problems before they get out of hand. Uh, I referred to psychologically safe workplaces, and there is a national and state based program called Culture of Care through Associated General Contractors. And I really wanted to impart a little bit more about this concept of psychologically safe workplaces. A psychologically safe workplace allows you as a human being to bring your authentic self to work, where you don't have to feel like you're hiding or covering up part of who you are just to be in the workplace. Also, when you feel psychologically safe, you're not distracted by the things that are making you feel unsafe. And so you're able to dedicate your mental resources to focusing on the job and staying safe. Um, so psychological safety plays dividends in things like substance abuse prevention, pays dividends in diversity, equity, and inclusion work, pays dividends in safety and your overall workplace culture. People want to work somewhere where they feel safe. People want to work somewhere where they feel valued and where they feel seen and their contributions and experience and knowledge are all respected. So the idea behind culture of care is about respecting one another. It is an acronym and it stands for commit, meaning to commit your resources and commit yourself to having a caring workplace. Uh, a stands for attract. Attract is simply bringing all the people, whatever past experiences, whatever your race, your color, your nationality, sexual preference, any of those things, bring all of the different types of people and different experiences to the workplace because there is space for all of us in construction. And kind of the old adage, if you build it, they will come. If you build the right culture, then we can get the right workers into our industry. We do have a skilled labor challenge in construction. And if we're not making space for all people, then we're going to continue to have a skilled labor shortage over time. The R stands for retain. Retain is essentially once we get people here, we want to have a culture that's so warm and inviting and promotes people's experience and diversity of thought to a point where they want to stay. They don't come to construction and go, you know what, it's pretty miserable and I don't want to do this. And again, that's going to help us with our skilled labor issues, but it's also going to help us create an environment where people show up to work and are healthy and whole. And lastly, empower. The E stands for empower. And it's really important to acknowledge that empowerment is not just empowering minorities and disadvantaged folks to speak up, it's also about empowering folks in positions of power or people who do not necessarily come from a diverse background to speak up for those who cannot speak up for themselves or to make space for those who cannot speak for themselves. So culture of care, having a culture of care in your workplace also contributes, like I said, to psychologically safe workplace, but it can help with other issues like suicide prevention and mental health promotion. Construction also, in addition to leading with regard to opioid overdose and substance abuse problems, we also lead the country with the number of suicides. And those aren't statistics that we in construction want to be known for. That's not what we want to be about. We want to be about having healthy workforce, having healthy workplaces, having positive workplaces that are truly engaging and that we can continue to build the communities around us. So it's really important to not just promote safety, but worker health as well. So make sure that there's resources for getting help. There are tons of resources through Culture of Care and CPWR, as well as many other agencies for getting help for workers, whether it's mental health help, whether it's substance abuse help. There's a lot of resource. We need to avail ourselves of that and promote it. We need to have designated allies at work, people that we know are safe people to talk to, people that we can go to when we feel stressed or overwhelmed or feel threatened by something that's going on in the workplace. Another thing that I can't stress enough right now, especially because of the pandemic and just the mental health impacts that we've had, is reminding those of us on our teams that it's okay to not be okay. It is okay to be struggling with everything that's going on around us. Um, and, and and be empathetic with that. It's okay to not be okay. And here's some help, here's some resources. So, in order to be able to help, you need to know what your company's employee assistance program and health insurance offerings are. And the company as a whole needs to also know what those resources are and promote them. Promote them in places where folks can see them, not just saying, hey, contact the EAP, but sharing, what's the contact numbers for the EAP? What's the contact information for our health insurance? What does our health insurance cover with regard to mental health and substance abuse? And promote that, because if people know that that resource is out there, they're more likely to access that resource. So, again, having a culture of care is really about establishing a rule in how you treat people. For many, many years, we've said, the golden rule is treat people the way you want to be treated. But frankly, we can do better than that. We should treat people with the platinum rule of treat people how they want to be treated. So, acknowledging who a person is, what their past experience is, what makes them unique, and acknowledging that and treating that with dignity and respect. All of those things are going to contribute to having a workplace that is safe, is healthful, and that we all are positively promoting one another and helping one another out. So I'm going to leave you today with a QR code on your screen. You can actually scan that QR code with your phone, and it's going to take you to the CPWR. CPWR stands for Center to Protect Workers' Rights, and they have an entire resource landing page dedicated solely to preventing opioid deaths in construction. So again, if CPWR has acknowledged this as an issue, we certainly, as an industry, really need to um, pay attention. We need to access these resources. We need to share these resources. There's tons of training materials on there and different things that you can print out and share on your particular job about how to look out for one another, how to look out for signs and symptoms of substance abuse, how to prevent them. If we have a psychologically safe workplace, we're preventing opioid overdose upstream. We're catching people before they're in crisis, much like promoting the suicide prevention lifeline and some of the other resources for mental health. It's better, it's way more effective, it's way healthier for everyone involved if we catch it upstream, if we catch the problems before they become a crisis and we insert the right resources into the mix. We can actually save people, and not just save them from crisis, but we are saving their long range health and getting them resources so that they can manage their own health as well. So I encourage all of you to engage with the CPWR resources. I encourage you to think about your impact in your workplace, the ways that you add value and ways that you can do better in regard to supporting your team, in regard to creating a culture that is helpful and really attracts the people into our industry and then retains them and their knowledge, but also makes it a safe place for them to want to come to work every day. So I appreciate you taking the time today to hear this message. I appreciate you dedicating time to learn more about this issue. And I challenge you to go out and make a difference in your workplace culture so that we can prevent some of these deaths that are clearly preventable as long as we have upstream intervention. So, thanks for being here and have a wonderful day.